Hey, good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Thanks for joining me for this broadcast. Broadcast number, I don't know what, in this pandemic we've been having. And by the way, I want to thank Dr. Coons, who filled in for me last week. Did a really nice job. So thank you to Dr. Coons for that. But you're stuck with me today. And I was hoping today would be kind of a sleepy holiday update with what's going on with the pandemic, but not so much. So I'm going to get to it, and we're going to do it this way. I'm going to do a little different. We'll show you our usual graphs that we have for information. And then I'm just going to kind of hit on different topics related to where we're at with the pandemic right now. And as always, as I'm in the course of discussing these things, send me your questions and I will do my best to answer them. So with no further ado, let's get at our charts, and we're going to take a look at those first. So this is the weekly update. On the left are cases in the past week, which actually look better. You see the cases in the last 2 weeks, which look a little better as well. We'll see. Let's wait till we talk next week and see if that remains the case. I have a hunch that there may be we're dealing with holiday stuff here in terms of some of this reporting, because what we see in terms of numbers elsewhere wouldn't suggest that that's the case. But anyhow, that's what we have to show you for now, at least right now from the county health department. And then let's move on to the next slide, if we might. So those are just our numbers, Monday, Tuesday, Wednesday. And once again, when you see on Monday such a big number compared to the other days, I think we have some stacking going on. So it'll all get sorted out in the end. But I think the take homes here are that, yeah, numbers are definitely up from where we've been at in the past, and positivity rates trending up. Actually more so in the state than actually in our county right now, but nonetheless, the positivity rate is trending up as well. I think that's the last of the graphs we have. And then what I'm going to do is just kind of start talking about some topics. So I'm going to start with Omicron. I'm going to pronounce it Omicron. I know there's different pronunciations that folks are using, but I'm going to go with Omicron and some points on that. And there are really right now more questions than answers about it. But here's what I wanted to share about it. First of all, transmissibility, or in other words, its ability to infect others. It sounds like it's around 3 times more than previous strains, variants. And there's even, I saw some number I was looking at that they're predicting 60% of the US population will be infected with Omicron before this surge is over. And it doesn't mean everyone's going to have symptoms, but 60% would be infected. It also appears very likely that the number of people who get Omicron that are hospitalized and or die is going to be lower than the previous variants. How much lower? I'm struggling to find an exact number on that, and I think it's just because it's still relatively new. I saw a couple studies out of the UK, but they weren't willing to extrapolate that to the rest of the world. So I think that'll become clearer as time goes on. And that is a really important thing, of course, because, okay, it's one thing to have a bunch of cases. It's another thing for those cases to result in people being hospitalized and or dying from a virus. So I know in the upcoming weeks, as we continue to have our broadcasts, that we'll have better information about that. But that is a big unanswered question right now. As far as showing symptoms, that also is an unanswered question about this variant, the Omicron versus the others. Numbers are being thrown around. I'm a little hesitant to throw out numbers, but I would say that there were some questions about whether up to 90% of the people that get infected with this particular infection may be asymptomatic. We know that other people are asymptomatic with the other variants. So that's a number that's going to be interesting to get in to figure out as well. So time will tell on that question as well. So what that does mean too, though, is that if in fact there's a lot of there's more asymptomatic people now than there even were before when we get our case counts, that means that the actual number of cases circulating around, and the likelihood that as we go about our lives, we'll run into someone who inadvertently has the infection and could be spreading it to others goes up. We also know about the Omicron is that it appears that the time from exposure to getting symptoms is going down somewhere around 3 days. We also know that it's spreading pretty quickly. The latest information on that is on December 18th, about 22% of the US population had Omicron, and now it's on the 25th of December. They're putting this out every Tuesday. So on the 25th, based upon Tuesday, 25th, that wouldn't have been Tuesday. Anyhow, I was reading that every Tuesday. Anyhow, on the 25th, as of the 25th, I guess it's as of the 25th, and then they report it later, was 58%. So we'll see what next week's are, but it'll be higher. Last I saw on Delta, by the way, we were about 41% of the cases were Delta. So CDC isolation quarantine criteria. Matt's going to put up some information about that. I'm sure all of you are beginning to see this kind of information. And would you move that? I think you have it goes up, doesn't it, Matt? Do we have a part that's for the isolation? Yeah, if you go up with that. Thank you. So first of all, before I even go into this is based on what I was reading from the CDC as they're kind of more and more understanding this virus, that it seems a day or two before you get symptoms, and maybe and 2 or 3 days after you have symptoms seem like the key times when people shed this virus. And so based upon that, and I think also there's the understanding that we also have to do our best to let people go about their lives and not have folks just blanket isolated or quarantined if we have new information. So trying to balance all that. And they came up with this in terms of their recommendations that Illinois Department of Public Health and Whiteside County Health Department are also in line with. So the first one is isolation, which means if you're positive for COVID, and whatever your vaccination status is, you got to stay home for 5 days of the recommendations. And if your symptoms are gone or resolving, you can leave your house, but they're wanting everyone to wear a mask around others for 5 additional days. And if you have a fever, continue also. So that doesn't count if you have a fever. You don't get out. We don't recommend that you leave the home in 5 days until that is gone away. And I would say reasonably gone away for 24 hours. So that's the isolation side. Quarantine side. So there's 2 categories here. So if you've been boosted, if within 6 months you've had your 2 mRNA vaccines, Pfizer or Moderna, or if you're within 2 months of having your J&J vaccine, you can go about your business with the understanding you're going to be wearing a mask all the time around others for 10 days and test on day 5, just to make sure that you haven't popped positive and don't realize it. And of course, if you get symptoms, you pop into the isolation bucket. If it's been more than 6 months since you completed your first 2 vaccines, it's been more than 2 months since your last J&J, or if you're unvaccinated, please stay at home for 5 days. And then after that, wear a mask for another 5 days when you're around folks. And if you, I don't quite know what that category would be, but if you can't quarantine for some reason or other, you're going to have to wear a mask for 10 days. That's the recommendations, and test on day 5 for folks who are in this bucket as well. So that's my best opportunity. That's my take home from this. If there are any questions, feel free to send my way. I know all of you have probably seen this and looked at this as well. It's one of these things where I don't know about all of you, but it's going to take a while, and maybe it never will happen. That it's going to be if this situation pops up for myself, a family member, an employee, I'm going to look at this chart and I'm going to kind of go, okay, here's where you are on this chart, and here's what you need to do. So I'd encourage you to do the same as well. Okay, thanks. Okay, vaccines. Speaking of vaccines. So here's the latest I have on the mRNA vaccines, the Moderna and the Pfizer. Latest I can find, if you've had 2 shots, about 35% effective in terms of this newest variant, in terms of preventing symptomatic infection. About 75% effective if you've had a booster in terms of preventing symptomatic infection. Even with this new variant, this virus is still a virus of the unvaccinated in terms of hospitalizations. So last numbers I was looking at were 14 to 1 in terms of hospitalizations, and 5 to 1 in terms of symptomatic infections, vaccinated versus unvaccinated. And granted, that data does probably not include a lot of Omicron in it. And so we'll get more detailed information as Omicron begins to surge and we get more information. But, my story hasn't changed a whole lot in terms of get vaccinated, in terms of that helping you. What I think is more and more changing, I would go on to the J&J vaccine, is it's clearly not as effective as the mRNA vaccines. Also, there's been some information lately about it causing rare blood clots. So in a nutshell, I would recommend that I can't think of many reasons but why you wouldn't, but I'm recommending, I think most folks are recommending, get an mRNA vaccine rather than a J&J vaccine. J&J is better than nothing. I think the benefits outweigh the risk of the J&J. But other than having to get 2 shots, I think the mRNA is clearly becoming the way to go. Masks. Okay. So have had a few, even before the show, some questions about masks. And one of the things that we're doing here at the hospital, particularly in light of the increased transmissibility of Omicron versus Delta and other variants, is there's more and more data out there that suggests that by and large, cloth masks are not going to be as helpful in terms of keeping folks safe as 3-ply surgical masks. And so we've kind of been kicking around this at the hospital, and we actually are, even today versus yesterday, are tweaking this. And what we're basically saying is, if you're going to come here to the hospital and see patients, whether that's here at the hospital or one of our clinics, we're highly recommending that you wear a surgical mask when you come into our facility. Not mandating it, but highly recommending it, just in light of the new information that's available. You have to wear a mask. So you're not, that thing is a mandate. You're, in terms of coming in and being taken care of here, you need to wear a mask. But we're really highly recommending that you go with a surgical mask rather than a cloth mask. And we're offering patients surgical masks if they don't have a surgical mask when they show up to be taken care of here at CGH. So that's kind of the background and the recommendations behind all that. And we're just trying to make this the safest place it possibly can be to be taken care of. That's what it boils down to. Now, I will say that there's definitely more and more information, particularly with the increased transmissibility of this Omicron variant, that if you're someone who is at higher risk of getting really sick, particularly being hospitalized with this variant, there's more and more information coming out that you may be better served in public places, particularly indoor public places, to wear a KN95 or wear an N95 mask. So just throwing that out there in terms of those of you who would fall into a higher risk bucket. And okay, just a little levity to the situation. I think this is a levity, but also information. Is I saw this thing about a study they did in China on hamsters, and they fitted some hamsters they fitted some hamsters with surgical masks and some not, and infected some and didn't infect others. I don't know. They did it. And so in the course of that study, one of the things they learned is that the masks were helpful in terms of preventing others from getting infection if the hamster was wearing the surgical mask. And it also seemed to have some protection for the hamster who was wearing the mask in terms of them getting infected from other hamsters. Enough of hamsters. Let's move on. Cases. So definitely seeing more cases of hospitalized patients here at CGH than we have in the past. And by the way, we do post that every day on our website. You'd go to menu and under menu, you'd pull up under, I think it's patients and visitors under COVID resources. We give a daily update of the number of COVID patients that we have hospitalized here. But yeah, that number's up, probably higher than it's been in quite a while. So, the end of the Delta surge is happening. The beginning of the Omicron surge is occurring. Even now, some flu stuff is beginning to hit. So, thanks for putting that up, Matt. Yeah. You're starting to see some flu activity as well, although not tons, but it'll be here. So for all those reasons, our numbers are definitely going up here at the hospital. Obviously, the U.S. number of cases are at a record high. I'm sure you read that today. So it's happening, and so that's kind of where we're at with cases. Next point is the rapid antigen test. I saw something yesterday where it's looking like it's going to be helpful, but not as helpful as as with the other variants in terms of picking up Omicron. So in particular, I think right now what is being said is if you do an antigen test and it's negative and you still don't, but you don't feel that great, you feel like, geez, it seems like I have this. I don't know that I would just assume that I'm negative. I think it would be appropriate then to go and get what's called a PCR test, which you can get our Ready Care, and they do PCR testing. So that would be the follow-up to that. If you're negative and you're still worried, or the other option there would be if you're negative and you're still like, gosh, it seems like my symptoms are suggestive of this. These tests are designed that you take it the next day. So if you were to wait and not get around folks and try it again the next day, I think if I were you, I'd feel better about I'm negative if it's negative again the next day. So that's another option there in terms of that. So I think we're going to learn more about this in the next few weeks as well. But I wanted to share that. So what % of admissions are unvaccinated? So Jackie, like I was sharing earlier, it seemed I've seen some data 14-1. A couple of weeks ago, in our region, the numbers were kind of trending towards 9-1. It's pretty high proportion of folks. Let's say around 90% are unvaccinated. So that's kind of where we're at. Lisa, symptoms for Omicron. Yeah, some similarities. I don't hear as much about losing taste and smell, although I'm sure that can happen. A lot of people have cold symptoms. Of course, people get fevers, body aches, those type of things. That's kind of where we're at right now in terms of Omicron symptoms. Anything where it seems like it's a cold or something else, assume you have it, get tested for it, and then if you're okay, then you can move on. So I wanted to talk about cases versus hospitalizations, because that's really a really important differentiator here. So, if the right people got COVID, we would have very few hospitalizations. But who gets sick is really important, because if you're at higher risk, whether that's because you're unvaccinated, you have a risk factor, something along those lines, or even if you're vaccinated and you're older, then the hospitalization thing begins to become an issue. And obviously, one of the things that we're concerned about here at our hospital and every hospital is trying our best. It's not, the cases are important, but it's really more about flattening a hospitalization surge so that as we get further into this Omicron surge, our hospital cases don't go up so high that we really struggle to take care of everybody that shows up. So that I just want to differentiate that. So speaking of risk and being at risk and high risk, so just to clarify, that the number one risk for folks getting hospitalized is age. So if you're 65 years plus, we know that about 3/4 of the people that have passed away in the US have been over 65 years of age. In September of 2021, at that time, your mortality, your risk of dying was about 80 times greater if you're 65 plus versus if you were 18 to 29 years of age. But I want to be clear about something else. So it's very clear that age is a big deal in terms of being at risk. But I want to mention 3 other ones that as I talk to folks, I just don't think folks always key in on this, that they could, even though they're not over 65, even if they're in their 30s, 40s, 50s, could be at risk, or 20s for that matter. And here are the 3. The one that I think the most of is obesity. So by definition, you take your height, you take your weight, and you get something called a BMI, a body mass index. And if your body mass index is more than 30, you fit the criteria. And granted, if you're a weightlifter and you have all this muscle, then it doesn't count. And there are certain reasons that it wouldn't count. But in general, that's a pretty good idea, approximation of where you stand on that. And I hear folks talk about, I'm a healthy person. I don't take any medicines. And that's true. But if your BMI is more than 30, you do fall into the bucket of being at higher risk than the general population. So that's important for folks to know. Pregnancy is also one of those higher risk situations. And I think folks kind of know that, but I just wanted to mention that. And the third one is if you smoke. So there are others, but those are the ones that sometimes I get the sense that people don't always make the connection that could be me. And I want folks to understand that. Okay. Jill was asking, are there other illnesses that you're seeing that patients may be confusing with COVID? Right now, I would say we're not seeing a lot of the regular flu, Jill. And, we're always, when someone gets admitted to the hospital, if there's any question about, is this COVID or something else, then we're doing other testing as well. So we're doing, let's say someone has a fever, but their x-ray doesn't necessarily look like you don't see any COVID changes on it or stuff like that. It's not uncommon for us to do a blood culture to see if the patient has a bacterial infection. If they just have a fever and don't have any other symptoms, then we're not necessarily stopping, even if they have a positive COVID test, and say that's just COVID that's causing that. So, in answer to your question, not everything that looks like COVID is always COVID, and you never say never that we're catching everything, but our antenna is up here at the hospital when someone shows up to the hospital to be looking for other things besides COVID. But long answer, and I'm going to give a shorter one. I don't know, 95% plus of the patients who come into the hospital who seem like they have COVID, they have COVID, at least right now. That's because of the pandemic. Hope that answered your question. Thank you. Anyhow, monoclonal antibodies. So the monoclonal antibodies that we've been using for Omicron don't look like they're going to be as effective. So we're transitioning to a different monoclonal antibody called, you're going to remember this one, I won't, Sotrovimab. And it appears that one's going to be effective, and I'm hopeful that we'll find others. And the government's controlling the allotment of that. So that's kind of where we're at with monoclonal antibodies. And we are still giving monoclonal antibodies here at CGH. Merck and Pfizer's oral pills. So I'm pretty sure you've heard bits and pieces about these pills. They're going to be distributed, when they're distributed, my understanding is now, to the big chain retail pharmacies. My understanding that the government has procured 10 million treatment courses of these oral pills. Sounds like they're not probably going to be a great fit for someone who's pregnant. Definitely what I'm seeing, the Pfizer is going to be far more effective than the Merck product. And it does look like, so far at least, they're going to have effectiveness for Omicron. And the other thing about these oral pills that we're going to have to gear up for is there definitely are some drug-drug interactions. So, it's not going to be a slam dunk that they're a fit for everybody to take. So and I don't know, we're still not sure when the supply line is going to start pumping those out, and they're going to start seeing those locally. But that's what I know right now about those pills. So the Illinois Department of Public Health, as of December 28th, has begun centralizing COVID contact tracing. So in other words, positive cases, rather than being handled by the local health departments, are going to the state. A couple reasons. I think it has to do with resources at the local level and at the state versus the state level, so they can contact these people that have been exposed to someone who's positive more quickly. And it also takes the burden off of local health departments, who have a lot of things placed upon them right now. So my understanding is that people who have phone numbers in the system will actually get texted about what's going on, and then have opportunities to call and ask further questions. So that's a new thing that happened as of this week. Like I said, not a sleepy holiday week. As far as I know, I've had this question come up too, and Matt hasn't even put it up, but it was a broadcast question. And is there a specific test for Omicron? And, how do you know that you have that variant? And the answer to that is there is not a specific test for Omicron at this time. The tests that we do are more general to COVID and just to COVID. So what happens is that at the state level, that positive tests, a certain percentage of them are brought in from different regions of the state and analyzed in a state lab to determine what the variant is. I just don't think that states have the resources to do every test that's done. And not only that, but report that out in terms of what variant it is. So no, there is not a particular test. It's done more of a global thing. So that's why every week I'll be reporting, and I know it's coming out from the state and the CDC as well, what percentage of cases regionally, statewide, nationally are Delta variant versus Omicron variant versus some other variant. Okay. Final pandemic related thing is just that I just want folks to understand and know this, that we'll get through this, and we're going to transition at some point in time from a pandemic to an endemic situation. It will happen. Don't know if this is the variant, this Omicron. If we get through this, if we're in that camp, I hope so. I don't know, but it will happen. And so what I think here at the hospital, our recommendations and our thought would be, until then, we want to do our best as a community to protect the most vulnerable. We want as a community to do all we can to prevent overwhelming our hospital with like a surge type situation where we really struggle taking care of all the patients who show up to the hospital. And when I say that, I don't just mean the COVID patients. So right now, it's really tough. It's not impossible, but it's really tough sometimes to get patients transferred, whether they have COVID or something else, to other facilities that normally it wouldn't be a big deal. It's a big deal right now. So, that's another reason that we definitely want to, as a community, are asking our community to do all we can to flatten the surge, if you will, somewhat, so that becomes less of an issue. And Jill asked, "Are we at capacity?" No, we can. We're not at or beyond capacity at this time, Jill. Yep. Thanks, Sue. Yeah. So this is part of that situation as well, is that it can take a while to get folks placed, and I'm glad you brought that up, Sue, and glad to hear from you, Sue, by the way. But yeah, it's much more of a challenge now when folks are in the ED, getting them elsewhere, and so yeah. Please understand that if you hear about that, that's what's going on. It's our ED folks are doing their best to get folks triaged and get them to where they need to go. It's just been really difficult at times lately. So just keep that in mind, and that's just how life is right now. So I also would just say, and I guess finish in terms of the pandemic conversation, because I don't want to take up much more of your time. But I just encourage folks to continue to live life, but live smartly. An example I'll give is, so like I have family members who they're immunocompromised. They're on some chemotherapy. And so when I'm going to go visit them, the day I take off, I'm going to do a quick antigen test, and make sure that I'm negative before I get around them. Because I want to make sure I'm not an asymptomatic person who would be spreading that to them. So when I say live smartly, that's one of the examples that I would give that I think we can do to be helpful. I would say that if you're someone who is at risk, and keep in mind, at risk includes those three things that, in addition to age, and of course, unvaccinated status, it also includes obesity, pregnancy, and smoking. If you're an at-risk person, just be really smart about how you go about things right now. In particular, when you're inside in a public space, particularly a public space where people aren't going to be really diligent about wearing their masks, I would consider wearing a surgical mask that's a 3-layer surgical mask. But it's really, I Google and take a look at some of the articles that you can see. But I think definitely the trend is towards like a KN95 or one of those more universal fitting N95s that you can get over the counter. And then if you're under 50 and you're healthy, let's face it, your risk of hospitalization and death is pretty low. So the reason that my ask in terms of that group of people is to mask and to vaccinate more as a civic duty, caring for our neighbors, to protect those who are vulnerable. And also to, for the hospital, for our hospitals too, for CGH and other hospitals, once again, to prevent, if we keep those folks who are more at risk of getting sick, who would show up in the hospital, and when we're around them taking the right precautions, then that helps hospitals in terms of being able to handle the patients who show up better. So that's my pandemic thoughts. I'm open to any other questions that you might have about the pandemic. Hi, Donna. Oh, thank you. I thank you for saying that. I can't appreciate much how much that means to me. And when I walk around and see our folks and day in, day out doing this, I'm so appreciative of them and the work that they're doing to take good care of people, because they're doing it. And yeah. So speaking of a McGlone, I want to give a couple of shout outs. And the first shout out I want to give to is to Dr. Tom McGlone. He's retiring, and December 31st is Tom's last day. And I want to thank him for myself and also on behalf of all of CGH for giving us 18 great years. So Tom, thank you. And we wish you nothing but the best in retirement, and we'll miss you. But I wanted to give Dr. McGlone one final shout out as he's departing. So thanks, Dr. McGlone. Yeah. And Julie's our medical staff. She takes care of our medical staff, and she's saying the same thing. So thanks, Tom, and we wish you the best. Okay. And Tom, by the way, was on our board as well. So not just as a physician, but as a leader here in our hospital. And the other shout out I want to give is to Kimberly Teets Garrison. And Kimberly works over in Morrison. She's a PA over there. And she made KWQC News Hometown Hero Award. And I talked to Kim probably every couple of weeks, because I still pop over to the Morrison office and talk to the folks there. And she does care bags to nursing facilities, has been doing that for a long time. So, hey, Kimberly, I can't say enough good things about Kimberly. She is the real deal. And I knew that before this Hometown Hero Award thing happened. But shout out to you, Kimberly. Thank you. Okay, I've taken more time than I usually do, but I thank you for sticking with me, and I thank you for listening. And hey, until we get together again next week, hope you have a great week, safe week, and Happy New Year.